want to welcome everyone to today's special presentation on staying healthy, staying informed, what to know about UTIs as we age. A couple of disclaimers before we get started today. The session is not going to provide any specific medical advice for anyone, so we hope you take the information from today's session and use that to discuss with your medical providers what would be the best for you specifically. Before I introduce our presenters, I'll also mention that Senior Planet seeks out subject matter experts for these programs, many of which have used their expertise in the for-profit sector. We're thrilled to have Lindsey and Megan here today. They've got a ton of fantastic information to share with you. I will just note that as a nonprofit, Oats and Senior Planet does not specifically endorse any platforms or products. So we hope you take these learnings, look at the market, like I said, discuss with your providers and see what would be the best fit for you. Today's presenters are Lindsey Williams and Megan Henken. Lindsey is the co-founder of MyUTI and a strategy and product commercialization expert with extensive urology experience. She has a personal passion for improving women's health and is most happy building creative solutions that empower women to take control of their health journeys. Megan, also co-founder of MyUTI, is an accomplished global marketing leader specializing in the area of women's health, urology, and clinical diagnostics. Having personally experienced the impact of frequent UTIs, she's channeling her industry know-how to improve the lives of women. So without further ado, I'll turn it over to you, Lindsey and Megan.
Thank you so much. Hello, everyone, and welcome. I am Lindsey Williams, and here with my co-founder, Megan Henken. We are thrilled to be here with the Senior Planet community. Today, we are going to be talking about urinary tract infections, or UTIs, and how they change as we get older. And this session is designed for anyone who is navigating UTIs themselves, supporting a loved one who navigates UTIs, or is just wanting to be informed. So let's dive in. So here's our roadmap for today. As we age, UTIs can become more common, but they also tend to show up in different ways. So we will walk through what a UTI is, how symptoms may change with age, the importance of accurate testing, how to talk to your doctor, and some tips to reduce your risk of UTIs. This session is meant to help you feel more informed, prepared, and confident when it comes to your health or supporting someone else's. So UTIs are the most common bacterial infections, especially for women, but they're not exclusive to women. They occur when bacteria enter the urinary tract and multiply, leading to symptoms like urgency, burning, or discomfort. And as we age, UTIs can present differently. So you might not experience burning or pain. Instead, symptoms could look like confusion, dizziness, or sudden fatigue. And while early treatment can work well, recurrence of infections is more common with age, which is why recognizing the subtle signs is so important. So what is a UTI? Most UTIs start when bacteria, often E. coli, from the GI tract enter through the urethra. So that can affect the bladder, urethra, or even your kidneys. And while common, especially in older adults, the symptoms can vary widely depending on your age, sex, and overall health. Classic symptoms of a UTI include burning during urination, a sense of urgency, pelvic pain, or cloudy or strong smelling urine. But again, many older adults might not show these particular symptoms, which is why we have to be extra alert. So as we age, UTIs present in sometimes unexpected ways. Classic symptoms like burning or frequent urination might still occur, but older adults often experience more subtle signs like sudden confusion, fatigue, or an increase in falls. So these signs are especially important to watch for in caregiving settings. And after menopause, declining estrogen levels can thin and dry the tissues around the urethra and in the vagina, making them more vulnerable to infection. So the natural balance of protective bacteria also changes, making it easier for harmful bacteria to grow. And this helps explain why UTIs become more frequent in midlife and beyond. And while less common than in women, UTIs can and do occur in older men. A major contributor is an enlarged prostate, which can make it harder to fully empty the bladder. And this leftover urine can become a breeding ground for bacteria. And men using catheters or those with recent prostate treatments may also face an increased risk of UTIs. Some people find that their UTIs keep coming back. And this may be due to embedded bacteria hiding in the bladder wall or multiple types of bacteria contributing to an infection that could be missed in testing, or antibiotic resistance from repeated treatments. So about 80% of infections that are recurrent come from the same bacteria reemerging. And while there's no one-size-fits-all prevention strategy, there are steps that we can take. So good prevention can start with small daily habits like staying hydrated, urinating after sexual activity, avoiding bladder irritants like caffeine and alcohol, and exploring vaginal estrogen therapy if you're postmenopausal. If you've had multiple UTIs or continuous symptoms, you can bring that up with your provider, and it's definitely a conversation worth having. If you or a loved one starts to show possible symptoms of a UTI, especially things like confusion, weakness, or fever, it is definitely important to get evaluated. We recommend bringing notes on any past infections, current medications to your appointment with you. And for those who are in assisted living or caregiving environments, just making sure communication is key.
All right. Now let's talk about some conditions that can mimic urinary tract infections with urgency, burning, or that feeling of abdominal pressure. These conditions may feel like a UTI, but they aren't actually infections. These include vaginal changes from menopause, like irritation or dryness, pelvic floor muscle dysfunction. This is where the pelvic floor can be too tight. Prostate inflammation in men, also known as prostatitis, and chronic bladder pain. Testing helps distinguish between these conditions to rule in or rule out the presence of an infection. When it comes to testing for urinary tract infections, there are really three main types to know about. There are urine dipsticks that are fast, but just preliminary, as they don't identify the bacteria causing the symptoms. This is often done in a doctor's office and is a strip that is dipped in your urine. Urine cultures are considered the gold standard and take about 1 to 3 days for the results to get back to your physician. This is because the bacteria needs to grow in the lab to be detected. Then there is PCR testing, and in this, it is used to look for the bacterial DNA. You may have heard of PCR testing before. It is similar technology to what is used for PCR COVID testing. This advanced testing for urinary tract infections may be used with people experiencing recurrent or complex symptoms and is accessible typically through a specialist. For UTIs, antibiotics, generally speaking, are the standard treatment. However, treatment should be guided by accurate testing and your symptoms. Common antibiotics used are nitrofurantoin and Bactrim, and in severe cases, IV antibiotics may be needed. Non-antibiotic options like vaginal estrogen have been demonstrated to be extremely effective in reducing UTIs. Or taking supplements like cranberry and D-mannose may help prevent reoccurrence. If you are prescribed antibiotics, it is very important to actually finish the full course of your antibiotics, even if your symptoms subside. Why it is important to use antibiotics only when essential is because we want to avoid antibiotic resistance. As older adults, we are more likely to be exposed to antibiotics, whether for UTIs or other conditions, which increases the risk of developing a drug resistance. Resistant infections are harder to treat and more likely to result in hospital stays. Again, this is why we really suggest testing first. And it is important to confirm there's actually an infection before we start taking any antibiotics. If you are a caregiver, know that behavior changes like confusion or increased falls may be the first sign of a UTI. Be sure to encourage testing to confirm or rule out an infection. Ask your provider what kind of tests they are using and if it's the best fit for the symptoms. Also ask about prevention and don't be afraid to request a deeper look to see about drug resistance or other strategies that may be more appropriate if UTIs and symptoms keep reoccurring. And most importantly, take care of yourself too. Caregiver stress is real and it's okay to ask for help. So let's help get you prepared for that doctor's visit. First and foremost, know your history. This may require you calling your doctor's office or logging into your EMR to get the information and understand what kind of testing has been done and what were your specific results. When you see a specialist, they will want to know the type of testing, the treatments prescribed, and if there was a confirmed UTI diagnosis by culture or other testing method. Keep a log of your diary, keep a diary or log of all your symptoms. Are there certain activities or certain things that you notice that may trigger your symptoms? Also, jot down what home remedies or medications you may be taking to resolve your symptoms. Also, be sure to document any other antibiotics or meds you may have been taking. All of this is important in talking with your doctor as you decide your treatment path forward. And if UTI symptoms are reoccurrent, ask about underlying causes or alternative prevention strategies besides antibiotics. There are many myths about UTIs. For instance, not all UTIs cause pain, bacteria in your urine doesn't always mean an infection, and antibiotics aren't always necessary. The truth is, UTIs in older adults may not look like a classic UTI, and tools like estrogen can be a game changer for reducing infections. UTIs are manageable, and you do not need to accept them as a normal part of aging. We've reached the end of the presentation, UTIs as we age. I hope this gave you some insights. We're happy to open it up with questions or let us know today what stood out to you.
Thank you, Megan and Lindsey. If folks would like to put any questions in the chat, we'll bring them up. I know there's one question which is asking if you can explain a little bit more about D-mannose probiotics.
Sure, I'm happy to take that one. So supplements like D-mannose or cranberry, the way that they work is that they help coat the bladder and make it inhospitable for bacteria to adhere to the pili, is what it's called, that's on the inside of your bladder wall.
Great. Thank you very much. There's a request from Donna in the chat. If you could show the last slide again. Maybe leave that up. We'll take a couple more questions. I see Leanna, hope I'm pronouncing that correctly, as hand is raised. I'm going to ask you to unmute. You can ask your question. So Leanna, there should be a little pop-up coming up on Zoom that says you've been requested to unmute.
Okay, good afternoon.
There you go.
I take something called oxybutynin for frequency. Would that give you a UTI? So in other words, before I was going to the bathroom like every hour. Since I've been taking the oxybutynin, you know, I go every 4 hours. Would that give me a UTI?
I would suggest speaking with your physician. What you're talking about is overactive bladder, and yes, they will give you antibiotics to help space out the frequency of urination. So if you are experiencing UTIs or any sort of pain with urination, I would talk to your physician to see if you are experiencing any sort of urinary retention and if there is something that you can do there. Again, vaginal estrogen is also a very good tool that you can use if you are experiencing some irritation.
Okay. Thank you.
Of course.
Great. I'll do a couple more questions from the chat, and then Anna Marie, we'll get to you after that. Next question is, can regular clean catch urine tests detect UTIs, or do doctors need to specifically be looking for them?
Yes, so this is a good question. So when you go to the doctor's office, I think many of us are familiar with going to the bathroom and giving a urine sample. And during that time, you're given a wipe and you're asked to do a clean catch. And so what that means is wipe, urinate a little bit, then catch some of the urine in the cup for them to test. The reason why they call it a clean catch is they want to ensure that you've actually wiped and that there may not be extra bacteria that's there in your sample that would interfere with results. Depending on the type of testing you have done, if it's a culture, they care about that because they, like I explained before, it grows when it's in the lab. So they want to make sure that you have the cleanest sample possible.
Great, thank you.
Mhm.
Someone is asking, if you have type 2 diabetes, are you more prone to UTIs, or are UTIs genetic? Be more prone to that.
Both. So yes, type 2 diabetes, you are more prone to urinary tract infections. And then studies have shown that UTIs can be genetic. So if you do have a grandmother or mother that was more susceptible to urinary tract infections, you may be as well. May be more anatomical than anything else, like the length of your urethra. Women notoriously already have shorter urethras than men, which makes us more susceptible. But yes, it can be genetic as well, as what some data shows.
We'll go to Anna Marie next. You've got your hand raised. I'm going to ask you to unmute.
Hello. What is the source and form of D-mannose probiotics? Where does one find that particular item?
Yeah, so D-mannose is actually a sugar. So you are going to want to speak with your physician about the dosage that you take. You can search online. There are a number of companies that are reputable that we would suggest. If you do go to our website, there is a company called West Coast Mint. You can also go directly to them. But on our website, we do have an area with supplements with companies and products that have been vetted by our clinical team.
We've got a request to show the slide with the causes again. Lindsey, if you don't mind pulling that back. A question in the chat from Martha. Is it definite that your urine will smell if you have a UTI, or can that smell be, how much is smell an indicator that you might have a UTI?
Unfortunately, smell is not a great indicator. Smell can actually just mean that you're dehydrated. So when we age, big factors in causing UTIs can be dehydration, especially in men. So dehydration also leads to constipation. Constipation can make you more susceptible to urinary tract infections. Again, also shifts in vaginal pH. I did see a comment that says it may not be an effective tool because of my risk for cancers. Recent data has proven that has shown that vaginal estrogen is a safe and effective tool for urinary tract infections for all women, and especially women as we age. So I would highly encourage your practitioner to read up on the latest data that's out there.
Thank you. Another question here, and Kate, I see your hand raised too. I'll get to you shortly. Will change of diet help with UTIs? So you talked about some of the different supplements and things you can take, but what about changing your diet?
Lindsey, you can, I'm answering, you can jump into it.
No, thank you. Very
Yes.
fine. You were on a roll. Yes, absolutely. There are known bladder irritants. I think we mentioned things like caffeine, also alcohol. And so there are recommended diets for people who are more prone to UTIs that do include like, low acidic foods, those types of things. So again, that's a great thing to bring to your practitioner to ask about what kinds of things can you avoid if you are more prone to UTIs. Also, that's another area where it would be a best practice to keep a log of the foods that you are eating and maybe be able to narrow it down just so that you don't have to cut out all the fun things that are out there.
Yeah. And again, just kind of going back to the being regular. So making sure that you are including fiber in your diet, drinking plenty of water. Those are going to also be some of your best tools to help manage and flush out your GI tract and your urinary tract.
I've got a question from Miriam in the chat here. Just a little bit of backstory. So my previous doctor prescribed a 1 milligram tablet of estradiol daily. My current doctor recommends stopping this medication. So maybe pulling back away from the specific, what should Miriam do prescription wise? She's asking if there's a concern about artificial versus natural estrogen. So asking if vaginal estrogen addresses this issue, and what is vaginal estrogen? Is it a cream? So how would someone taking vaginal estrogen experience that?
Yes, so I would, not knowing your condition, if you're taking systemic estrogen or if you're doing a topical, but yes, there's a couple ways that vaginal estrogen can be dispensed. One is a cream, and you do a tiny little pea size, and you apply it to the tissue, and it really helps with thickening of the walls. So because as we age, the thinning and the changing of the pH does make you more susceptible to overgrowth of bacteria. So that could be UTIs, and that could be other conditions as well, like yeast infections and things like that. So I would talk to your doctor about the different delivery methods that are best for you. I would just say whatever lubricant, whatever estrogen you are using, topical estrogen, it is not a vaginal lubricant for intercourse. So you should use something different if you are experiencing a little bit of pain with intercourse.
Thank you, Megan. Next question, I think this goes back to something we were talking about a little bit earlier, which is overactive bladder versus a UTI. So do you have information on what causes overactive bladder, or things that people can talk to their providers about if it's an overactive bladder versus a UTI?
So actually the definition of overactive bladder is symptoms in the absence of a UTI. So oftentimes if you're going through an overactive bladder workup with a specialist, they will test you to make sure that those symptoms are not caused by a UTI. There are a lot of overlap in terms of symptoms, so that's an important differentiation for your provider to make. And again, that goes back to reinforcing why the accuracy of testing is important to ensure that you're properly identifying the cause of your symptoms and then can move forward with the best treatment path based on your symptoms, your test results, and your clinician's recommendations.
Next question. Can having recurring UTIs over many years eventually cause any damage to the bladder?
This is a great question.
I
don't know that we have a ton of research on this, unfortunately. This is an area where we need to do a little bit better in medicine to research the impact of this. I will say there has been recent data that shows actually the bigger impact is the continued exposure to antibiotics on your gut microbiome. So that is more of, I think, a scientifically or studied outcome of recurrent UTIs. In terms of bladder function, Megan, are you aware of any research on bladder function impact? I'm not.
There are some studies and connections to conditions that can, yes, that recurrent infections of the bladder can lead to, but I would talk to your provider if there are specific symptoms that you're concerned about that you think are causing other conditions.
Loving how many questions we've got, a very engaged audience here, so certainly keep them coming. Next one is, what is the research on vaginal probiotics for prevention?
It's mixed. I'll be honest with you. And by vaginal probiotics, there's the oral, right? So there's medications or probiotics and supplements that are suggested to take orally that help with your vaginal or urinary microbiome. Just remember it has to go through your gut before it would even have a chance to somewhat get through your cells to your vagina. Your gut isn't attached to your vagina. Your gut is attached to your GI tract. So just anatomically something to think about there. If you are talking about vaginal, more like suppositories that you could use, there's boric acid, there's some other ones that help with lubrication. I would just really encourage you to do some homework, talk to your clinician. I think there's sometimes a lot of claims about what supplements can and can't do, about balancing things out. And unfortunately, they may not all be as effective, and the data shows that as well.
All right, thank you. Next question from Joni. So Joni's 71 and gynecologists wouldn't wouldn't prescribe vaginal estrogen in the past due to family ovarian cancer. Had a complete hysterectomy last year. So is estrogen still a risk for breast cancer? I know this kind of goes outside of the UTI realm. If you have an answer, we'll take it.
Yeah. Well, I hope your recovery is going well. A hysterectomy is no small thing to go through, so hopefully you're doing okay now. But yes, the data has shown that using estrogen in this case would be a safe and effective tool. There's some great physicians that you can follow online. If you guys are on Instagram, they're on YouTube, all sorts of things. Dr. Kelly Casperson is amazing. Dr. Rachel Rubin. They put out a lot of information and share data with you about these types of tools for women as we age. There's also Dr. Barbara Hanna. She's a gynecologist who also specializes in the menopausal woman. So Dr. Lauren Stryker. I know I'm throwing a lot of names at you, but there's so many wonderful female physicians that are out there, online urologists and menopause experts that you can get this information from. And then you can also look on a website called the National Association for Menopause. And they have a whole list of physicians that you can seek out to talk to if you would like more specialty care.
A lot of great resources coming at you there. I'm going to group a couple of questions together. I know you touched on this a little bit, but can you reiterate if men can get UTIs and if drinking alcohol, such as beer, can dehydrate someone, and in the question, a man, and cause UTIs?
Lindsey, you want to take that?
Yeah, I was going to say alcohol definitely. I mean, any kind of dehydration. So, can contribute to UTIs. Typically, men experience UTIs less often than women. So statistically, more than half of all women will have at least one UTI in their life. Only about 15% of men will, right? So it's much less common in men, but the same types of things can contribute. Certainly dehydration is one. I think we all know alcohol is both a bladder stimulant and not a substitute for water. in terms of hydration. So something to be aware of there. I've also popped up that slide on the screen of, things that can contribute to UTIs in men as well.
Thank you, Lindsay. And Megan is putting some of the names of those doctors she was mentioning earlier in the chat. So if you want to grab those and look them up online, or I think she said a lot of them are on Instagram, those names are there because I know there were quite a few. All right, next question we have is how can one stop a UTI and bacterial vaginosis from going back and forth and back and forth?
Oh, the combo, yes. This is unfortunately a lot of times what one will experience is that you will get an antibiotic for your UTI, and that antibiotic will create an imbalance in your pH, and then that will lead to a yeast infection. Some physicians will prescribe cream to avoid that happening. This is where taking a probiotic, even a gut probiotic, right, while taking an antibiotic can also be helpful, just to try to keep things, symbiotic continually through that course of antibiotics. There are also situations in which BV and UTI symptoms can overlap a little bit, so you may be struggling with one or the other. Meaning that you may need a different type of treatment if you have BV, but it feels like you might also be getting a UTI. Megan, do you want to add anything to that in terms of how testing can differentiate between BV and UTI also?
Yeah, so testing, so bacterial vaginosis, kind of like the name implies, is an infection in the vagina. Classic symptom is odor. And so as Lindsay mentioned, shifts in pH as we age are very natural. You do see the overgrowth or undergrowth of certain bacteria like Gardnerella and other pathogens. So when there is overgrowth, that's when you tend to get discharge and a lot of the odor symptoms as well. And potentially irritation that feels like a UTI. So talk to your doctor about getting tested for both, because then you can rule out, UTIs happen in the bladder, like Lindsay showed, in that urinary pathway. So you'll get a urine sample that will be for that. And then you would do a vaginal swab sample that would be for the bacterial vaginosis confirmation.
Thanks for moving back to this slide. It might help with the next question too, which is asking how bacteria enters the urinary tract, especially if you practice good hygiene.
Yes, I have to say this is probably one of my biggest soapboxes, because hygiene seems to always be to blame for women when it comes to urinary tract infections. And the reality is it's just the way our anatomy is. It is a very short distance from the exit of your GI tract, from your anus, your vaginal canal to your urethra. It's very small. So even if you're wiping, even if you're practicing, like going to the bathroom after intercourse, bacteria don't have very far to go. On top of the fact that you may have some shifts in your pH, so it does make you more susceptible. So with that, like, you don't need to be using baby wipes. You can just use water and a washcloth, very gentle soap when you're cleaning. Please do not douche, do not use all these extra things that you see at the store to make you smell like roses and all these things that actually can cause more irritation because of the perfumes and dyes that are in there. So if you are susceptible, just soap and water. And if you do have incontinence and you're wearing pads, just change those regularly, like I'm sure you're already doing. And I think, just remember that hygiene seems to be a pretty easy scapegoat, but I'm sure you're probably doing a very good job of wiping appropriately and doing everything that you need to. But maybe some other ways of cleaning instead of baby wipes would be a more gentle way to go.
Helpful. And I'm going to stick on this topic a little bit here because I think we have some related questions. Some folks have heard that the type of underwear can have an effect. So is wearing cotton underwear better? And then you touched on this a little bit just now, but if you're, wearing light pads or other adult hygiene products, maybe just kind of reiterate when we want to change those.
Yeah. So, incontinence as we age, it does happen. And so many of us are using the products. So you just want to make sure that you change those regularly, especially if you experience fecal incontinence. You'll want to get those changed because, as I said, it's a very short distance to travel. And then to be sitting in the urine or the fecal matter, just make sure that you change those out regularly. And then as far as your underwear, yes, cotton underwear are things that are breathable, certainly recommended. I don't know that there's strong science that says that I've heard all sorts of things that you need to replace all your underwear multiple times a year. There's no strong data and science that actually agrees with that. But if it makes you feel good, I'm not going to tell you not to do it. But yes, generally speaking, wear underwear that's breathable, change your incontinence products consistently, and so you're just not wanting to sit in it for a long time.
And one more on the hygiene topic, at least for now. What about using a bidet? Does that have any positive effect?
I love that. I think it's gentle, would be, save you from doing the really irritating products. Yeah, go for it.
Right. And the next question is, how many times is it normal to get up in the night and go to the bathroom?
Yeah, that's if you're experiencing nocturia and you're getting up multiple times in the night, you do want to talk with your physician and figure out some behavioral strategies, whether that is finishing your last glass of water at a specific time. And the reason why it's really important to talk to your physician is because you do put yourself at an increased risk for falls. It's the middle of the night, you're trying to rush. So you really do want to make sure that you're talking to your doctor about what solutions you can do. Maybe it's drinking caffeine not so late in the day, just looking at other things like that. But certainly you don't want to completely stop drinking water because then that'll end up having a negative effect with the constipation. So I would recommend talking with your physician.
You. And I'll also share in the chat, about a month ago, we did a different presentation about sleeping and urination definitely came up. So the importance of sleep. So I'll share the recording for that one in the chat in case people are interested in checking that out. Right. Go to Leanna next. You've got your hand raised. I'll ask you to unmute.
Hi, this question is for Megan. You mentioned that you should change your pads or the panty liners frequently and consistently, but how many hours? Or is it in the morning you put on a new clean one and it can go all day till the night? Or should you change it like how many hours in between?
Yeah, you may want to change it, not a full day, going a full day. If you think about that, you probably have gone to the bathroom several times during the day. I would suggest changing it maybe every 4 to 6 hours, depending how frequently you are going to the restroom. If you've had a bowel movement, I would recommend changing whatever you're wearing. So that would probably be what I would recommend. If you are caring for somebody also that is wearing these types of pads and products, things get sweaty down there. So just be mindful, look what's going on, and change them out, I would say, multiple times a day, every 4 to 6 hours.
Thank you. Thank you very much.
Mm-hmm.
All right. We've got a question from John. John, I'll ask you to unmute. John, there should be a little button that pops up on your Zoom screen. It says you're being asked to unmute. You click that. Oh, it will unmute you. Seems like we're having some trouble there, so we'll try again if you can get it unmuted, or you can feel free to put your question in the chat as well. We'll go to Ty next, and then I'll go back to some of our questions from the chat. So Ty, I'll ask you to unmute here.
Oh, great, thank you. I'm not sure, did you talk about baths and taking baths? Did you already talk about that?
We did not touch on that. And the
Okay,
biggest thing
so-
with baths.
Well, wait a minute. Before you mention that, I just would like to ask, for me, I do totally shower to clean my body first. And then when I want to take a relaxing bath, then I'll bath. But I don't bathe in bathing water. Boy, this is becoming a little difficult in stating. And then that's number one. Number two, what about, we have some wonderful spas around here, Korean spas and whatever. And I understand, the pH of pool waters. I'm an environmentalist, so can understand that chemistry, but what about the caution protection in those places? Thank you.
Okay, I will start with the bathing. The bathing. You've got me mixed up a little bit there. Okay, so the biggest issue with taking baths is, again, to kind of carry on from Megan's soapbox there, it's actually not necessarily the hygiene component as much as it is the products being used. So it's actually the chemicals and things in bubble baths. A lot of the lovely bath bombs and things, those sometimes contain chemicals that can be fine for your skin on your body, but maybe not okay for the sensitive skin for your vulva or your vagina, right? So again, altering that pH, which can then lead to harboring of bacteria. Also, the impact of potentially sitting in warm water for too long that can impact the pH balance there as well. In regards to spas, I mean, I think probably I'm not an environmentalist, so I will caution this answer with that disclaimer there. But I imagine that the chemicals used in, pools and hot tubs would apply to the same chemicals or things that may be used in, public communal bathing pools or those types of things as well. So obviously, those can be irritants. The biggest thing and recommendation that has been given typically there is to just make sure that you are changing out of a bathing suit, not staying in a wet bathing suit for long after you've been in a pool like that. I'm not sure if that addresses your question around spas specifically, but that is typically the recommendation that is given in order to avoid UTIs when it comes to pools and hot tubs.
We'll do a follow-up question from the chat here. Epsom salts, are those something considered safe to use in a bath?
I'm not aware of anything.
Heard anything specifically about Epsom salts. I think you just have to be mindful that now there's a whole aisle of those things that have lavender scents and all these pretty scents. So I think, again, it goes back to kind of what I said, like write down what you notice your triggers may be. So if Epsom salts at baths have worked for you and you don't notice that you start to get any irritation after, then it is something that would work with your body. If you're noticing other sources of irritation or dryness, causing burning, then just make note of those so that you start to keep a log and understanding the frequency and potentially what your triggers are.
And then the only thing I would add to that is if you do want to use some of those products, just minimizing the amount of time that you're staying in the bath with those products. And then also as a recommendation, just to rinse the body with clean water afterwards and seeing if that potentially helps.
All right, taking us back to some supplements for a minute here. So I think we mentioned taking cranberry before, but there's cranberry juice out there as well, maybe a little bit more fun to consume. Are there any recommendations? Should you look for ones with or without sugar, concentrated? Are there other juices that would help with UTIs, or is it just cranberry?
Well, the data shows that it's cranberry, and to be honest with you have to drink a lot of cranberry juice to get a reasonable effect to reduce some of the symptoms that you get with urinary tract infections, because cranberry does not cure a UTI. What it does is it helps flush the bladder, maybe helps reduce some of the painful symptoms with urination. So just make sure that you understand that it's not a treatment, it's a tool that you can help manage your symptomology. Now, water also can help you flush and help you manage some of the symptoms. Believe me, I know, like going to the bathroom when it hurts that bad is not ideal, but water is one of your best tools. Using azos as well. When it comes to supplements and cranberry, no, they are not all created equal. It is really important to make sure that you follow what the science says is going to be the most important for you. And this is kind of a tricky one, so maybe Lindsey and I will put it in the chat, but you want to look for supplements that have 36 PACs in them. And that is the ingredient that has been scientifically proven to help coat the bladder and coat those pili that I talked about and keep things from adhering. Now, if you are going to take supplements, I will readily admit I am terrible at it, but it's about consistency. So to get that preventative management value out of a supplement, if you are making the investment, you need to take them consistently. That is the D-mannose and the cranberry. Those are going to be some of your protective tools to use.
Great. And then a follow-up question on the D-mannose. So how often should you be taking that? How many scoops? I'm guessing it depends on, how on your weight or another factor that's to the individual. And do you have any reputable companies to recommend for D-mannose specifically?
Yeah, I would talk to your physician because it is a sugar. You do kind of need to make sure you understand how that is going to work with you and maybe other conditions you may have. For example, somebody brought up that they were diabetic. So their dosage is going to be different than somebody else who's not. So I would talk to your physician. There is a company called West Coast Mint. They are a good company that you can get both a big pack that you would scoop. I think you can also get it in a tablet form too. So maybe a company to look into.
Okay, go to some of our raised hands here. Grace, I'm going to ask you to unmute.
I thought when I took CIPROFLOXACIN HCl, I took 250 mgs of it. It was really a lot involved because you have to take the medication 2 hours before or 6 hours after antacids, iron, vitamins, minerals, and you don't take it, of course, with milk or calcium. But that was really hard to keep track of. I did finally write it down, but I thought that was this CIPRO. I don't know how to pronounce it.
It's
CIPRO.
Yes, ciprofloxacin.
Yes. Tell me, is that true? Because I really kept a good schedule. It was very involved.
Yes,
2 hours before or 6 hours after, and it was antacids, iron, vitamin, minerals, and then don't take it with milk.
Yes, Cipro is a pretty strong antibiotic. So, it is an antibiotic that I would, if you did feel that the treatment and the guidelines to take it were a little bit much, I would talk to your provider about looking at a different broad spectrum antibiotic. There are others that maybe have less adverse events and adverse effects than Cipro. It is a broad spectrum antibiotic. So I would just make sure you talk to your provider and see if that's really what you want to take going forward, or if there's another solution for you.
Well, that's what I asked when I got it. And they just said, yes, that's what they give. So, because I've had it twice. So you're
Yeah.
saying that there may be something that would be, I just like to take, take a pill here and a pill there. You can get really involved as you get older. And it wasn't just that easy.
Yeah. So, I mean, I would talk to your physician about alternatives. There are certain, if Cipro doesn't feel right for you, write down what you've taken, why you don't feel that it is something that you want to use in the future. And there are other broad spectrum, depending on, this is where testing is important. So for you, it'll be important to understand what test did they do to confirm the bacteria in your urine. And then based on the bacteria that they find, that's how they choose the antibiotic. And it's not one bacteria, only one type of, there's usually multiple options that you can use.
Okay, that's what I wanted to hear. Thank you so much.
You're welcome.
Right. Now we've got just a little bit more time and a lot more questions, actually. There's been a ton of questions here, which is great. John, I know we had been trying to get you unmuted earlier, and I think you're unmuted now if you want to ask your question.
I am. Can you hear me?
Yes.
Sure can.
Okay, good. I was wondering how the UTIs in the elderly especially affect their mental state.
Yes, absolutely. So I think, as we had mentioned, sometimes UTIs can present differently in older people, meaning that they can present as basically, you may think somebody is having like a dementia type of symptom, right? Where they get confused. This was actually my personal experience with my grandmother. Where suddenly, we walked in the house and she was sitting at the kitchen table and she just looked not herself, and she was having a hard time putting together sentences, those types of symptoms. There is, more of a sudden impact in those symptoms versus like what you would see in a more of a standard like dementia type of pathway. So that's one cue to know if this is a sudden onset. Maybe we need to look at this as a UTI. But that is definitely a very common reason why older adults may not be correctly diagnosed with a UTI, because the symptoms don't show up as bladder pain, frequency, urgency that many people associate with UTI symptoms.
And if you are taking care of somebody who has dementia or Alzheimer's, they can become a bit combative during an infection. So also something to just be aware of if that's outside of the norm for them typically.
Yeah, so delirium versus dementia, I want to make sure I'm clear on this. Delirium is more sudden confusion. And is reversible, right? So like if it is a UTI, those symptoms, once the UTI is treated, that will go away, versus dementia, which is a slower, progressive type of scenario.
Great, thank you. And there were some other comments in the chat, I think, that people have had some similar experiences with this. So thank you for reiterating that. All right. No, we're getting close to the end of time, so I can't promise we can get to everyone's question, but we've gotten to a lot, so I hope you've got some good information. I'm going to have two last ones for you all here. Can you go over the difference between a yeast infection and a UTI? We touched on this a little earlier.
Yeah. So a yeast infection, the symptoms are going to be a little bit different than a urinary tract infection. So a yeast infection, generally speaking, is when you're going to have like irritation, itching, discharge on the vulva and the vagina. Now, Candida, which is the pathogen that causes a yeast infection, can actually get up into the urethra and cause a urinary tract infection. So with Candida, what the doctor will prescribe, so if you are tested, again, it's important, you've got over-the-counter solutions, but if you're having to use that repeatedly, you should go see your doctor and get something a bit stronger than the over-the-counter that you can get at a CVS or Walgreens, and they'll give you a prescription for something like I cannot ever say the word, but it starts with an M. I'm drawing a blank. Is it mitraconazole, Lindsey? Anyways.
Oh, yes, I know what you're talking about. I can never pronounce it either.
Yeah. And it's usually a 7-day course. You want to finish the course. It comes in tube, so you want to make sure to do that. And then also with the UTI, again, your symptoms are just going to be different. It's going to be a lot of like that urgency and pressure, burning with urination, not so much irritation with wiping. Yeast infections have more of that.
Thank you. And before we get to this poll, can you just repeat the cranberry number, the amount that people should be looking for?
Yeah, 36 PACs. So there's companies, I'll put something in the link. I'll put something in the chat, some links for you guys.
Yes. So before we close, if you don't mind, we would like to take a moment to do a quick poll on what topic you would like to explore more in a future session. We really appreciate the engagement on this session. So whether it's more on urinary health, menopause, or sexual wellness, your input obviously helps us to shape what comes next. So if you want to use the chat and enter 1, 2, 3, or all. And then also if you have other ideas of topics that we didn't cover, we would love to hear that as well.
Thank you everyone for joining. Megan and Lindsey, thank you so much for all of your insights and knowledge. Like I said, we got to a ton of questions today, so I really appreciate you taking the time. I'm going to leave this session open for just a moment or two more while people answer that poll. As I said at the beginning, the recording of today's session will be posted to Senior Planet's YouTube channel in a couple of weeks. I'll drop that link in the chat again here, but keep an eye out for that. And like I said, thank you all for joining. We hope to all have a great rest of your day.
Thank you guys for having us and your great questions.
Yes, thank you.